when I was 15, I once told an advisor that I really like therapy and I think I would like to be a psychologist. And, she just went like this. Like, I was so disconnected with my essence. Anyone who goes to therapy or has started to become ready to go to therapy or wants to change something knows that there's something that they need to pay attention to. You can't heal the body without healing the mind.
I actually think that psychology could be above everything.
We now know how malleable and changeable the brain and our neurocircuitry is. We do have our contribution. And I think it's the most life-changing thing to be able to recognize in what way are we contributing to our situation and how can we change it? How can we make it better?
Hello and welcome to Portraits. My name is Paula MacNeill, and this is a podcast that explores all the layers and aspects of today's global society. We are going to dive deep in one's personal story about a big change, whether it was moving countries or blending cultures, or simply changing the trajectory of life's path and finding a fulfillment and meaning. Today, we're going to be talking with a clinical psychologist, Dr. Ava Ghasemi. Hi.
Hello.
I am really happy to see you here. And I just wanted to say that what really resonated with me was your Instagram account name, which was Dr. Ava Ghasemi, Psychology Geek. I love it because I feel like I am the same. I love listening, watching everything, psychology. It's my theme, and clearly, obviously, yours even more.
Awesome.
I have so many questions about psychology, but let's start with your own story and how and what led you in this path. So can you tell me a little bit, where were you raised? It's so interesting when I saw your website, it said that you speak Farsi, and I didn't know a language Farsi, and it's interesting. It's from, it's a Persian language. Tell me a little bit of your background.
Sure. Thanks for having me. So I was born in Iran and lived there for about 2.5 years. This was just around the time where there was post-revolution and the Iran-Iraq war had just begun. And my father got a scholarship to study overseas, which took us to Germany. Mm-hmm. And we arrived in a small town in Germany up north, which to me must have felt like in the middle of nowhere, coming from a big city like Tehran and going to a small town. And we ended up living in a really tiny town called Laboe. It was a small of 5,000 people. And I think I must have been probably the only foreigner in that town. I mean, I don't know if this is statistically correct, but at least in my little world, that's what it felt like. Yes.
Yeah.
And, my parents were young. My dad was a graduate student. He was an engineer and he was studying to get extra qualifications and was really working hard. And my mom, soon after we moved there, she was then, expecting my little sister. And so life had its challenges at times, young family in Germany.
So for you, blending cultures or starting or developing or growing was already at a very early age, that you had to adapt to new place, new rules, new social norms and all of that. Do you remember, you were quite young, but do you remember the first part of your life where, you had to keep up with your own culture, but also sort of blend in with where you were? And it's not like a big city in Germany, especially if it's a smaller village, then it's probably more eyes on you, right?
Yeah. I have lots of memories of that time, and good ones and not so good ones. But I think the ones that really stand out are the ones that were people that were very supportive, people that were very loving, people that were very kind. And there were a handful of people that, are still in my life, friends that I have kept for years and years and years, despite the distance and all the traveling that came afterwards. But of course, the not so positive experiences were, we're talking Germany in the 80s. And there were definitely challenging times with discrimination and prejudice and really feeling like a foreigner and being treated as such. This was a time where there was a lot of also refugees coming. And, my parents were very sensitive about that. They didn't want people to think that we were refugees. They really wanted people to know that we were actually there to study. And, they were educated and all these things. And at a very young age, I learned how important this is in some way, but not really understanding why.
And it's almost like try to justify why you are somewhere to people who are not owning the place, but you feel like you kind of owe an explanation, right?
Yeah, absolutely.
Yeah.
Absolutely. And I remember sometimes, people asking, what does your dad do? And, having lots of curious questions to, a little kid that's like 6 years old and can barely, spell out the word, engineer. I would forget, what does my dad do again? So these were just some of the earlier experiences I had. But then there was also some more challenging ones like, bullying and older kids in school. I've had a few incidents where, you get, chased and you're called names and things like this. Would
you say it was because you were a foreigner?
It's hard to know. I can't know for sure. Kids, regardless of being foreigners or not, can get bullied. But I think what can happen sometimes is just a feeling of vulnerability that maybe some other kids can pick up on. And that feeling of vulnerability can come from anywhere. For me, perhaps it was that I felt different.
Yeah.
But I think, you don't really have to have anything that is quote unquote, wrong with you, but still become a target if you're feeling perhaps somewhat insecure or different.
And did you feel these cultural differences? For example, was it easy to pick up on language in the school? What about food? It's very different, German food and Iranian food, for example. Music, culture, all these things that kind of probably your parents had more established because they're adults. But how did this cultural aspect feel when you're growing up?
I think at that point in time, those parts felt completely normal to me. My parents listened to regular radio and there were no restrictions around that. My parents were pretty liberal, open-minded. We watched regular television and, so we did immerse ourselves in many ways, but also remembering who we are because we also had family visiting or every summer we would go back to Iran and spend summers with my grandparents that were very dear memories to me and writing letters and, knowing our roots and knowing who we are, but at the same time, not being afraid to blend in some way or incorporate the other parts of the new culture into our lives. And so to this day, German bratwurst is still by far my most favorite type of sausage. Incorporating that is something I'm very proud of.
And for how long did you live in Germany?
So fast forward 7 years until, so my dad was studying there and worked there. My sister was born there. We lived for a few years. And then we moved back to Iran. And so, of course, at this time when we moved back, we are now around early 90s. So this is Iran post-war and coming out of a very, challenging economic situation and a huge, I would say, culture shock.
I wanted to say, was it easy to go back to? Because I had a conversation before how when you have a taste of the world away, when you go back to your hometown or home country, sometimes it feels like all of a sudden you're not really a part of that world either. Yeah. Did it feel like that as well? I guess in the first forming years as well, it's so important, to what forms you, basically.
Yeah, there's so many elements to it, but one of the most vivid things that I can again recall is that really feeling of going home, like being away for 7-8 years, away from the land where you are from, the land of your ancestors, where your lineage goes back to. There is something really sacred about that. Mm-hmm. And we did go back every summer, as I mentioned, almost every summer, and we have family visiting. But there was almost this feeling of like relief, like we're going home. Okay. So there was that. That was really positive. But there was also sadness about leaving behind, friends and people that were really, really lovely in my life, and who are people that are still in my life to this day. And, going then back to Iran, I think the best part for me was just spending time with, at my grandparents' house, spending time with the aunts. And I come from a very warm family where aunts and uncles, and we're very tight in that way. And we lived like upstairs from my grandfather, for example, or we lived with my great grandmother for some time as well. These are the early days while we were settling back in. I had my 9th birthday at my great grandmother's house, and this is like, a big garden that goes back, generations and generations, where my mom as a child played, or where my, grandmother as a, youngster was living. Yeah. So there's always these mixed feelings about it. So you are right. There's this part of like, because I hadn't lived there for some time, my Farsi, I had a very thick German accent speaking Farsi. Really? And so then you're kind of like, almost like a foreigner, but not really in your own country. So there was that. I was aware of that. But it was, the way people dealt with it was in a very loving and endearing way of like, oh, this, Western kid that's coming back, because there's also this feeling of, welcoming you back in. And so it was something I felt really proud of. And, but slowly then learning Farsi, learning how to write and things like this, that was really challenging, and adapting to a new education system that was very different than the German.
Yeah, it's interesting. It feels like for some people, it just life circumstances where changes come upon you themselves. And then for others, it's, it's an intentional choice. But I guess the intentional choice is when you're older. So maybe let's move to that. At what point did you make a decision what you want to study and which way you want to go? Did you know straight away? Did you have any doubts? For example, I at 20, before uni, during uni, and after, wasn't sure if what I'm doing is the right thing. And there's all these questions. Yeah. But yeah, how was it for you to kind of decide which is going to be your path?
Oh my goodness. I was so lost. Like in my teenage years, later teenage years, which is when you start to think about university and where to go and what to do. I was so disconnected with my essence, or what is my calling, or what would be my purpose, for various reasons. One, I grew up in a culture where you either become an engineer or a medical doctor, and everything else in between is like, not sure. Yeah.
Yes. Yeah.
So options are limited. And I also grew up in a family of medical doctors. My grandfather was a medical doctor. I had 2 aunts that were medical doctors. So very academic family. And engineers. My dad engineer, uncle's engineer. But I also had educators in the family. My mom used to be a teacher. My grandmother had studied to become a teacher. She went back to school later in life, and then sadly died at a young age. But there was a lot of, and I had aunts that were educators. And that part was not, it was well respected and people were proud. But at the same time, no one told me, oh, you should be a teacher.
Yeah, probably because teachers, although it's such an important position or, status, it's usually about, salaries and the teachers are
status.
It's a great thing to do, but also it comes with challenges that, you're taking on such a big responsibility, which is sometimes not, appreciated financially. Right. I feel like that's a global theme in every country.
I guess I kind of knew it implicitly, but it took me a while to actually understand it and crystallize it, which is that my grandfather was a medical doctor, but he was an internal medicine. He's still alive, but he's not practicing anymore. He is an internal medicine doctor, family physician, but actually a very big part of his practice was counseling and just supporting people through life's challenges. And people would, without being ill, would sometimes come to his office just to talk to him. And he was dealing with families and would see them from birth to marriage and, then kids and grandkids. And he had a practice in the same place, on the same street for decades and decades and decades. And so the part that was more, I guess, talked about was how he was involved in building a hospital and how he was in the military and the things that he had accomplished, the things that had to do more with the masculine energy and the parts that have to do with achievement and status and medals and those parts. Mm-hmm. But the part that actually, I think, was in some way I inherited were the parts that had more to do with just being with people and supporting people and helping people through difficult times. And then the educator parts, which are my aunts and my mom and those parts. And I went to a very competitive school where, again, you either become an engineer or a doctor. Nothing else is that valuable. If you're into arts, if you're into humanities, that's not, what are you going to do with that? Mm-hmm. So I was really lost. I didn't have guidance.
And I think for psychotherapy or psychology, probably then, now less, but still there is a stigma, especially for older generations, about what it really is. And is it a real science, or is it just, I have it in my family as well. Some people who haven't gone through or tried therapy, they just assume very, that's just talking. You can talk with, your friends, your family. Yeah. And they just don't understand why something like that is needed. And it's so fascinating when you start doing it to see how, there's methods and there's ways, and it just seems so effortless, but actually underneath there's so much of approaches that, a person doesn't even know that the therapist is doing, I guess, right?
Yes.
So maybe talk a little bit about how you chose. So inspiration came from grandfather. And how did learning, studying, and then practicing, how the therapy and psychotherapy changed you first, and maybe your view of the world and yourself?
Yeah. So maybe it would be helpful just to fill in the gap of what I ended up actually studying first.
Oh, you did?
Which is why I said how lost I was, because it took me a while to get there. So the first part was in Iran. I applied and went through all these examinations. A lot of Middle Eastern countries have this, where you have to actually, pretty sure Egypt is like this, where you have to go through these examinations. And then in Turkey is like this too. You go through these like statewide, countrywide examinations. You get ranked, and according to your percentile and ranking, you end up in different programs and universities. It's highly competitive. It's not at all based on anything you've done throughout high school or how well or badly you did in high school. It's based on this one exam.
Wow.
That happens once a year. So I took that year, super stressed out, went through it, lots of chronic back pain and stress. Only to learn that maybe I was studying for the wrong thing, but that's a different story. I then got into an environmental engineering program.
Wow. Okay. I mean, it's interesting. Yeah.
And your options are limited because they're like, this is your ranking. Here's what you could do. And I think one of them was I could do nursing, and another one was environmental engineering. And they seem almost arbitrary and so totally unrelated to each other. But I went naturally for the engineering because I was told, that's the right thing to do. And I was very happy about the location and the university where it was. And I got into a program where it was the same place as my best friend. And so you just kind of roll with it.
These decisions sometimes are, proximity and if someone practicalities.
Yeah, exactly. So then 2 years in, and I realized all I want to do is avoid studying. All I want to do is avoid classes. All I want to do is anything but what I was actually studying. And I was kind of cruising by and doing okay, but not really thriving and not really enjoying it. And at that point, we had applied toward immigration to Canada. So we're talking like late 1990s, early 2000s. There was a big move. A lot of people were migrating to other places too, like Australia, Canada. A lot of Iranians did this. And my father, to kind of provide this opportunity for us to have more mobility, to be able to have an opportunity to live somewhere else, also different citizenship, he had kind of opened this door for us, which I'm eternally grateful for to this day. So that was around the time when we were then being invited to come for what they call landing, like land in Canada and actually like set up your life there. And I was in this program and I was having fun with my friend. I was like, I don't know if I'm ready to go yet, and just wanted to kind of stick it out in Iran a bit longer. But my sister, who was a teenager, went, and I soon after followed. And at that point, I had to figure out where I'm going to study and what I'm going to do. I had already done 2.5 years of university and trying to find my feet. So I went to the closest university that I could find based on, I think back then we had MapQuest. It wasn't Google Maps or anything. On where our apartment was at the time. This like place we had rented, and found this university that was closest by bus.
That's what I'm saying. Yeah. We choose life paths, something we're going to do for years, just on something that's convenient. Right. I love it.
So I ended up at York University, and I chose biology. They told me you can study environmental sciences based on your credentials. You can do environmental sciences, or you can do biology. I was like, maybe I'll give that medical track another chance. So I'll do biology, and maybe that would be my path. So I studied biology and did that for a year or so, and found that so challenging. I, worked my butt off, but found it so like some things just weren't coming naturally to me. Math was fine, physics was fine. Those were, happy classes for me, but organic chemistry, physiology, I found it so painful and not enjoyable. I'm like, what am I doing here? So long story short, I took a psychology class just as an elective, and it was an introduction to counseling psychology, something along those lines. And I fell in love with that course. And the rest is history, because that course changed my life.
Changed the trajectory.
Completely.
Amazing. What was your family saying about this choice? Was it well received, or was it sort of skeptical? Or?
Well, at that point, I had applied to about 20 dental schools and had 19 rejection letters and 1 waitlisted. Because I soon realized, okay, medicine is not going to be for me. Let's try dentistry. And because you're like, okay, medical doctor, then comes dentist. So I tried that. And then when they then saw that how unhappy I was and how much I was struggling, I think they were just happy for me to find something I was enjoying. I mean, at this point, I was 22 now, and realized that actually I want to do psychology.
Oh, that's beautiful. I mean, 22 is actually quite young.
Totally.
Some people are still figuring out at 40, 50, 60.
Yeah.
So it's amazing to kind of, and sometimes people are so far in the path that they've chose that even if they know what they like, it's like, how do I start from scratch again? Especially kids, families and all that. But let's talk about that.
Yeah.
So you started studying psychology, fell in love, and can you tell me how it changed you? I think I mentioned that before as well. How, maybe before and after, sort of what you thought of the world before and how it opened your mind to new perspectives.
Yeah. So that class that changed my life, it was very experiential in that we had the opportunity to kind of role play and do some kind of mock therapy sessions. And the professor was a therapist himself. He was a very skilled therapist. He was very patient and happy to give us time to kind of find ourselves, which is very much what therapy is about. So you kind of go into this year-long experience of experiencing almost a bit of therapy. And we did all sorts of activities like art therapy and, talk therapy and learning about different conditions. And through that, I can only kind of make sense of it as I'm talking to you now, but I think through that, I realized that, okay, there are parts of myself that I want to heal. There are parts of me that need help, which is what drew me so much to this. And also there was just so much joy in seeing someone else's transformation or what is possible when you're working in these small groups or when you're seeing someone else open up or be vulnerable or talk about themselves in a way that they never have before. So it was very much a self-serving, but also, maybe this is my purpose.
I wanted to say, I think psychotherapy, probably learning that oftentimes a therapist or someone who's becoming a therapist is going through their own journey, and it's very much personal and, academic path. Weirdly, with other doctors, if you're a dentist, you're not constantly looking at your teeth. You're kind of going, it's not going so much through yourself, which I think is so important for psychotherapy as well. And I would even, you're saying medicine, dentist. I actually think that psychology could be above everything. I sometimes feel like a lot of physical things are actually in our heads, if not all of them, to be honest,
It's taken me like 20 years to get to that. But yes, it makes me so happy to hear that, because I agree. And I don't think it's hierarchical in that way at all.
Yeah.
And I agree, but I think it's very much kind of looking at it through a much more comprehensive, multidisciplinary lens that we need both. But you can't heal the body without healing the mind, and vice versa.
Exactly. And then which is so fascinating to me is that there are many therapy directions or therapy approaches and methods that you can choose at the end. Talk about, how did you choose which direction you're going to go for yourself? Was it because it helped you the most? Is it based on your beliefs that helped, again, you and others? Or talk about that.
Yeah. So when you're in grad school, you kind of learn a little bit of everything. And long story short, the process from undergraduate of realizing, I want to do psychology, to becoming licensed as a clinical psychologist, it's like a 10-year process.
Wow. From
undergraduate, master's, then doctorate. It takes about 10 years, give or take. If you do it in Europe, UK, US, a couple of years difference. But through that process, you are kind of, you learn little bits, and then you're thrown into the deep end of being in various trainings and working under the supervision of more senior clinicians, but with different sort of problems and different presentations of people that need help. So I worked in settings like with people with severe mental illness, people who had delusional disorders and schizophrenia and severe traumas and drug addictions, in a community mental health type setting, through to working with kids in schools, doing psychoeducational assessments and counseling from like little age of like 5 all the way to 18, and then working in university counseling centers where you're dealing with crisis intervention and kids that are away from home for the first time, dealing with heart-wrenching experiences or difficult experiences like assaults or drug issues and things like this, and trying to become kind of these surrogate caretakers for young adults who are away from home. Wow. And so loads of different
taste of everything.
Exactly. And totally out of my depth at many times along the way, because you're training, you don't know what you're doing, and you have supervision and support, and you're learning along the way. But you kind of get a feel of, okay, what am I comfortable with? What am I good at? What's difficult, but what do I really enjoy? And so throughout the years, I think I learned that I do really love working with people who want to heal their traumas, who want to have a knowledge of what experiences they've been through and want to deal with it, and are able to, they're ready enough to want to deal with it.
Yeah, I wanted to say, I think there's different types of groups to work with. Kids, it's very unintentional. They can't be like, okay, I'm going to work on myself. It doesn't work with with kids. And I feel like it takes some element of intellect or self-awareness or intelligence in that way to be able to recognize that I'm not perfect. This is, and also what's changed, and I love that right now, is that before I heard a lot, well, that's who I am. That was a phrase that I heard quite a bit. That's a person. She's always like, that's who she is. And I think now it's starting to change into, we're not who we are. We can be different. It just takes time and like really looking into yourself, right?
Yes.
Yeah.
I love that. I agree, because I think I am who I am is, yes, it's one part of it. It's like, perhaps that's the persona, or that's what we put out, or that's the way we might be most of the time. But first of all, we now know how malleable and changeable the brain and our neurocircuitry is, the wiring, and how we can change that, and how powerful all these interventions and different things that we can try can be. And then also there's many different parts to us. There's also other parts that maybe they're not out most of the time, but we all have them, and we know them. There are parts of us that maybe we don't acknowledge, or maybe we don't let other people see, but we all have them.
Yeah. And, most sort of the main theme of this podcast is about people making changes in their life, being brave enough to sort of changing the trajectory. And I was looking at your sort of overview of what you're doing, and that's one of the things. One of the things is helping people through change, also identity issues, which also kind of sometimes goes together. You don't know who you are, therefore you don't know what to do, and all these things. And how is it to guide someone through that process, and maybe like a little glimpse, like what happens in that process of helping someone go through change?
So that's a great question, because that brings us to, okay, what is therapy, and what does that look like? And psychotherapy is basically about providing interventions in the context of a therapeutic relationship. And these interventions tend to be things that other people have studied and examined and put into practice, that have been theorized or proven to be effective in some way in implementing and making change possible. So
maybe let me rephrase it quick about that change. I was just thinking, what are the main challenges that you've noticed people go through when it's either it's a change that someone wants to make but can't, get brave enough to do it. I guess there's different change. One is you want to change, and the other is something happens where change is inevitable. It's happening, right?
Yeah.
And these are probably two different directions we can go, but maybe you can talk about that.
Yeah. I think anyone who goes to therapy or has started to become ready to go to therapy or wants to change something knows that there's something that they need to pay attention to. Now, that change might be an internal change that needs to happen, which is the relationship with ourselves and those parts of ourselves. And just to put it into examples, like, you know, if I have a part of me that can be deeply insecure and anxious and can have this like limiting belief that I'm not good, that's something that needs attention, that needs changing. Because if I approach the world through that lens, I'm going to inevitably keep creating situations that keep confirming that belief.
And you know, we're going to that topic that I really wanted to touch on today, which is the negative inner beliefs. And I am fascinated with this particular thing because not all therapies, I've spoken to some of my friends and they have a different experience with therapy because there's a lot of approaches. But for me, it was so fascinating to learn about this inner negative belief and how it's not very straightforward, because it could be at the beginning, a therapist could ask me, well, maybe you don't feel good enough. And I'll be like, I think I feel good enough. Like, because here, like, I think I don't say that I'm not good enough every day. But then when you get in that deeper level of, you know, why am I reacting to this and what will happen? And then you kind of realize, oh, maybe I am thinking I'm not good enough if I'm expecting something bad to happen. And it's fascinating how it's sort of underneath our reactions oftentimes, and we don't see it straight away.
Exactly.
Right?
So that, just if you let me finish that part, which was about, you know, how did I come to do the work that I wanted to, like in terms of the therapies. It's exactly about that, which is that, okay, I realized that I want to work with trauma and that, you know, but people that actually want to change. And most people on some level know that they want to change. And so you asked me, like, what is it like guiding that? And so a big part of it is just this helping the person come to that realization. They know it already, which is why they've arrived to my room, or my session, my consulting room in the first place. But it's them coming to that realization, which is, what is it that you want to change? A lot of times change might look like it's something that needs to be changed on the outside. And sometimes it might be. You know, maybe it's that toxic job they need to leave. Maybe it's that difficult relationship that they need to step away from.
And it's also, I wonder if sometimes people can't leave toxic environments because they're weirdly attached to that type of dynamic as well.
Yes.
And then it's a question why. And it's just fascinating how you can dive in and realize, oh my God, maybe actually I secretly enjoy this chaos or this, you know what I mean?
Yes. There's that part. There's that part of us that, and I think, you know, I never want to make people feel that they are responsible for their suffering. And at the same time, I think we do have our contribution. And I think it's the most life-changing thing to be able to recognize in what way are we contributing to our situation and how can we change it? How can we make it better?
Yeah. I have a question that I don't know if you want to answer it. If you don't want to answer it, also good. Is there a bad therapist, good and bad therapist? Would you categorize therapists that are good and then people who are not good? I've just had these conversations with other people, and I will talk about how great my experience is and how everything, you know, how I'm meeting myself in a deeper level. And then others will be like, I'm not having that. No, we're having a conversation and therapist says, it's normal how you feel. And that's it. And I'm like, and the more I'm going to I'm like, oh my God, I want to tell everyone, you know, that go this direction.
Yes.
This is maybe, if you can tell me if there's different approaches that are necessary for different situations, or is the personal aspect plays a role for therapists as well?
Yeah. I think a big part, I don't want to get myself in trouble by like listing out what makes a bad therapist, but I think the big part that I personally am somewhat passionate about is helping therapists be clear about what they like to work with. And so I generally would, if my best friend asked me who to see, I would say, what do you want to work on?
Yeah.
I would actually try to figure out what is the person trying to address and who can be really helpful for that.
Okay.
Because not everyone is equipped to deal with everything. We had to do that in our training because we're providing free service in order to learn something. But when it comes to as people who are seasoned and much more experienced, I think it's important to be quite
niche.
Yes, specific about, okay, what do I like to work with? Because then I tend to attract people that like to work on the same things, and then we make a good team together, and then I can help them, and they are the right fit for me as well. I enjoy the work, and they get benefit. They get the same benefit out of it too.
I think it's sometimes for people because they don't know what they need to work on. Yeah. They just have the result of something, and they're like, I have anxiety, and then they don't know which doctor or which therapist would help the most.
Right. That is so true.
And then it sometimes takes the time to find the right match, and sometimes it's chemistry as well, I think, right? Yeah. Sometimes it's just, getting a click with another person. And sometimes it takes, I've had experience, someone I know that just had a sort of bad experience with therapist and doesn't work for me. And I feel like when it's a bad experience, they just tend to turn away from that. It didn't work with me, for me,
Yes. And that's really unfortunate. I think that's really, I think, sad if like the initial encounters aren't super pleasant or didn't click right away. But at the same time, I think I would tell people, like, don't give up. You know, if you had a medical difficulty and you went to the first doctor and don't know what's going on with you, can't help you. You don't give up. You will try another one. You will ask friends, and eventually you will land the one, and you're like, this doctor actually gets me. And they're interested and they want to figure it out. Yeah. But I think it can also equally be the most ethical thing for a therapist if they feel that they can't help the person that's in front of them to refer out and to say, actually, I'm not sure I'm the best person for you, but I can help you find someone that might be.
Yeah. That's so good. I mentioned before identity and identity issues, and I wonder if that's often for young people an issue or a big question. But I guess in every path of life, there could be the identity questions. What are the main questions people have, or concerns, or unclear? Feeling unclear about when it comes to identity?
I work with a lot of women, and I think a huge part of identity can be for new moms. That's a really big one. And, we see this all the time where, people that had a certain identity prior to becoming a mother, and then this life-changing experience, and a pause from career, not to mention if sometimes there's added to that challenges with child's health or difficult pregnancies or miscarriages or challenges in the marriage. It can get quite layered and complicated. And then coming out of that and slowly finding, I went through this, slowly finding our feet again with your feet back on the ground. Okay, maybe I'm ready to go back to work. Maybe I'm ready to, do this, do that. And then kind of feeling really unsettled. I think that's such an important phase of life change. And then I think there's many other ones as well, equally. Like, I also work with a lot of people with chronic medical conditions. And that on its own can have sometimes a shift in identity. Like, I used to be this super athletic, always up for whatever person. And because of this, severe autoimmune disorder or disease, I can no longer, I have to drop out of plans. I can't, I don't sleep well, which means I can't predict how I'm going to be. And so that's a very common thing for people who struggle with.
I certainly could relate to, after sort of postpartum, big questions of, or rather another part of your identity has grown as the motherhood, but then the other parts are sort of a little bit in the shadow, and then it's like you're serving others, and it's a topic I think for another episode. You can go in, because there's so many layers of like relationships, exactly, both romantic relationships. All of a sudden you're becoming mom and dad, and how to find time for each other. It's fascinating. I said to my husband, I sometimes feel like, having kids is set us to fail. Like there's no way of winning. It's like, we both were young professionals, and having kids all of a sudden put him more at work, me more at home. Yeah. And it's like we are living all of a sudden two different lives, and we need to like kind of, integrate each other with both of them. Let's not go into that, because I think it's a fascinating topic. Or
if I can just add something quickly in there, because I think it's very important with what you said with regards to cultural changes or, adapting. And I think one of the things that we can really struggle with in urban-driven societies, like this lovely place we live in, which we all love for the many perks we have for being here, is that we don't sometimes have that experience of being able to look up to the elders, or look up to our parents or community or people around us who've been through this. And we were away from a lot of us. I'm very, very lucky to have family here, and I've had my mother stepped in for me when I was with my little one in tremendous ways. But this is not something I could ever take for granted. And most people don't have.
Absolutely. There's a saying, it takes a village to raise a child. Yeah. And I feel like when you're on your own, or like in a much smaller circle, it's very overwhelming. Yeah. And just to touch on the other topic that you mentioned, which is very fascinating, because I also have people in my life who are, going through some health issues, and there's this unknowingness, that stuckness of not understanding how to change. Will it ever change? Will I? Yeah. How do you usually help these people, or what is the direction with people like that?
Yeah. I'm glad you brought that up, because I think I left that question a bit unanswered when you asked me about how to guide people. So the first was, kind of just helping them identify what it is that they want to change and what brought them here, and helping them with that, of what's internal, what's external. But sometimes the process can be really rocky, and we can get a bit stuck. And that, I think, brings us to some of the therapeutic modalities that I'd love to use, that have changed my life, and that have helped a lot of people. So one of them is EMDR, eye movement desensitization and reprocessing, which is a big therapeutic modality that I implement and incorporate in my practice. The other one is psychedelic psychotherapy, which I have trained in. Here, the process of psychedelics is very, very new. The only psychedelic that is legal here is ketamine, and is being used as a treatment for treatment-resistant depression. But it is an option, and as prescribed by a psychiatrist, it can be provided and can be tremendously helpful.
And is that sort of the microdosing methods?
Great question.
Yeah.
So with ketamine here, it's actually a prescription nose spray called Spravato, and it's prescribed by a psychiatrist. And then the therapy can be before, during, and after. In terms of microdosing, we don't, in a legal way, have that available here yet, but things move here fast and change. And, Dubai is usually ahead when it comes to it. UAE is quite ahead. And we've had a few conferences here that have addressed psychedelics and have brought speakers here. And so I'm really excited to see what that's going to look like in a few years' time.
And do you see your patients, are they interested in this sort of approach as well?
Yes, absolutely. There are a lot of people who are interested. And I think the key to that is really helping them understand why. Is it just because it's a buzz, or is it that they really want to work through something that they think is going to be helpful for them? And sometimes it's helping them figure out, okay, where and how and when would this be appropriate for them? And I like to work within legal means. And so if that means helping them find a good, reputable clinic or center or retreat that provides this, whether it's in the US where it's legal, or whether it's in the Netherlands, for example, there's many places where this can be accessed, then I might help them with that.
And it's sort of like a tool next to therapy. It has to be therapy first, and that is sort of something that can help the process.
Exactly.
Right?
And exactly. And any retreat that is quite reputable encourages the pre and the preparation and the therapy and the self-discovery beforehand, and the importance of really preparing for that, going into it with the right mindset, and also coming out of it and getting support with integrating whatever they were able to discover through that journey. My training was specifically with psilocybin mushrooms. So that's the training. That's also my own personal experience with it. So I love helping people with that.
I actually wanted to go to sort of my next point, which you kind of touched on it right now, that you have this holistic, comprehensive approach, which is not, at least how I understand, is not just psychotherapy. It's mindfulness. It's spirituality in a sense, and it just feel, I don't know, is that like all the therapists are like that, or is it sort of your approach where you kind of take all these other practices that maybe are not necessarily psychotherapy 101, but can help, right?
Yeah, I think what I basically drew from my own experience of what I found most helpful, and I tried to go out there and learn those things to be able to offer that. So I did year-long training in mindfulness when I was in one of my trainings throughout grad school. That changed my life. I went through these retreat and experiences, and I went and got the training. I had my own EMDR therapy after, being ready to face some of my own experiences and traumas, and that changed my life. And so I went and got the training. And so I love learning, and I love also educating people on what is available there, which is why we set up the directory for mental health professionals.
That is the Hello Hoopful.
Yes, it's hoopful.com.
Yes. Tell me a little bit about that. You're a co-founder of that. And tell me a little bit, what is this platform about?
Yeah, so hoopful.com, we created it myself and one of my dear colleagues, Madeleine Van Hanen, who's a wonderful couples therapist and individual therapist in the UAE as well, and my sister, who's an avid therapy seeker and has done therapy, but also works in organizational psychology and talent management. And so the three of us were like, she was always coming to me asking me, so-and-so needs therapy. Who do they see? And most of us therapists have this, where we kind of end up being the, yellow pages of, do we have yellow pages still? Telephone book for therapy. And so we're like, why don't we just create a directory and make everyone's life easier?
Amazing.
And so we basically called upon all our friends and people that were in the community, and we said, do you want to be part of this? And they were very gracious and joined in. And we then created filters so that people could actually look for what they need in a relatively user-friendly way. So being able to narrow down by, age and by presenting problem or symptoms and different approaches. Like if someone is looking for an EMDR therapist, or if someone wants to do CBT, or someone wants to see someone who does mindfulness.
Is that in UAE or is that
UAE.
internationally?
Yep, UAE. And so, and that was in 2021. And we have about 80 therapists on there, and it continues to slowly and steadily grow. And it's very grassroots. We created it on our own with, like I said, the support of our first 20 members. We were able to take it off the ground, and we don't have any investors. We don't have any fundraising. It's very much like our own efforts and initiative, and just putting our love and work into it. And we don't really make any money with it, but it's just providing something to the community.
I love it. I love it. I think the more people get to know and can make a very clear decisions, educated decisions, the more they can help themselves and they don't get lost. And I just absolutely love it. We're running out of time, so I'll ask just last question, because it's about change and for this episode, also identity and how to find yourself a meaningful sort of path. What would your advice be to a young 18, 20-year-old person who is lost like you were? If you would have to give one advice, what would that be?
Listen to yourself. Listen to yourself. Like, don't just, look for approval and validation on the outside, but try to find your own inner voice and that instinct, that knowing that, when I was 15, I once told a advisor that I really like therapy and I think I would like to be a psychologist. And, she just went like this, like, no,
really?
You should do more math classes. And
right.
I had, you have that in you, you have that voice. And, I think if I can help people listen to that, and if people learn skills on how to be able to access that within themselves, the world would be a better place.
I know. And would you say, do you regret any of the wrong, or do you even call them wrong choices, or sort of do we embrace whatever choice we've made along the way?
I think regrets are helpful. I don't see regret as a bad thing. I think, I have regrets. I
love it.
And
it usually is like, I don't regret anything. It led me to this point in my life.
Yeah.
But you kind of always see in hindsight, you're like, I could have done this earlier, right?
I think I definitely have parts of me that can have those regrets, and I can own it, but I try to listen to what the regret is and use the learning from it. Next time, listen to myself more, or remember, I'm okay. I love this.
I love that. This is something, we always talk about, just accepting who you are, but then accepting your regrets, or accepting, that there's sort of the shadow part of yourself is sometimes difficult.
Yeah.
Oh, I have so many more questions. We'll have to continue another time. Sure. Thank you so much.
Yeah, you're welcome.
I loved it. And please, if you guys are interested in psychotherapy, or if you're interested to change and grow, I would recommend to follow on Instagram, Dr. Ava Ghasemi, Psychology Geek. I love that name. And I also wanted to say about the platform, I have to mention it again. It was Hello Hoopful.
Yep, that's our Instagram.
So that's kind of good before even getting to a therapist, to go and check out what options there are and what resonates, right?
Yeah, we have some awesome therapists on there.
Beautiful.
We're very lucky to have them. Yeah.
Thank you so much.
Thank you.
And let's talk again.
Thank you. Bye.